Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. Today, we're talking about one of our very favorite subjects. I hope you hear the sarcasm in my voice. We are going to talk about who is benefiting, and that is insurance companies. And so, Shelley, let's talk about it.
Okay, so it is my sole purpose to not cuss throughout this episode because
Baseline, she's not a cusser, guys. Baseline,
yes. Nothing gets me more fired up than insurance companies and what's going on in American healthcare.
Yeah.
And it gets me fired up because I take care of sick people. And I see that they can't get, this country probably has the best medicines, literal medicines and healthcare medicine that doctors and smart people who are finding things, people fly from all over the world to come to Mayo Clinic and Cleveland Clinic. We have some of the best and the brightest. And yet the people who live in this country cannot access it. They cannot afford it. They can't get to it. And it is getting worse. Every time we think it could not, this has got to be rock bottom. It's got to go up from here. Nope. There's a new, grab the shovel because this is not rock bottom.
Well, and I think too, and I would say this across the board, most people go into healthcare because they care for people, yes. Right? And so when people come and sit in front of us and they're sick, I want to help them.
Yes.
I am like, what can I do? And I do try to be cost efficient. I'm not ordering frivolous tests. I am ordering what is the best for the patient. I often am asking, and a lot of times I know based on what their insurance is, what they could potentially afford. I have patients who, I had a lady yesterday who she's been my patient for a very, very long time. She's a special needs patient. Her mother, who was her caregiver, passed away. And some things happened because of that with her income. And so we were talking about her medications because she's having to stagger when she can get medications. It can make me cry.
Right. And so she's got all this stuff in life that are hurdles, and having enough pills when she has insurance and has a doctor should not be one of her hurdles, but it is all the time. And we see it so many times. And then our goal and why we did all the training that we do is to help people and to have intentional barriers put in front of us by insurance companies that prevent that help. It is incredible. And if you are in social media, you can start going down these trails of doctors who are just constantly putting out. I have seen in Socialgram, there's a social worker, in Instagram, social.
Don't worry, we don't know the social media.
In one of those, in Instagram, there's a social worker who has an entire site because the social worker is helping people combat their insurance companies saying no to things that should never be said no to. And it's ridiculous. He's, today I'm on the phone with someone because they approved everything for the surgery except the anesthesia. And so there was he was having to fight because a woman was in the OR getting a C-section and insurance was actively saying we're not going to approve an epidural. What are we doing?
Yeah.
How is this? And why are doctors in that OR, in that moment, focused on whether they can get this woman an epidural and get paid for doing it, as opposed to focused on saving the woman and saving the baby?
Yeah.
And this is what's happening, and it's across the board. So we would like to help make this make a little sense, but I promise you, I won't help it make sense because it doesn't make sense. It doesn't make sense. And we are intelligent and educated people. And when I read about this stuff, I'm like, this is so convoluted and this is so hard to understand. And that is not on accident. They have made it so intentionally convoluted and with zero transparency.
Yeah. Okay, so I'm going to ask you some questions. We're just going to go with questions.
Go off about it. Okay.
Okay, so the first one is, which it makes me laugh because you prepped me with these questions, and it says, it tells me exactly how you feel.
Yeah.
How is it you're getting so screwed? That's what
Yeah, I was like, Amber, you can ask me these questions and I'll try to answer them.
So, long story short, it's pretty much how are medication costs so messed up?
Yeah. So who thought it was a little bit weird when you paid a lot of money, more money than you've ever had to pay in the past for your health insurance, and then you went to your pharmacy, and when you got to the pharmacy, you walked up to the pharmacist at CVS and you said, I would like to get this antibiotic that's been around forever. And they said, that'll be $50 and you're going to need a prior authorization. I swear I've been asked to do prior authorizations for Bactrim, for amoxicillin. And then you call your doctor's office and you're like, I'm sick. I need this antibiotic. They're telling me it's going to be $50 days before I can get it and $50. And I say, pay cash. It's $4. Mm-hmm. And so how is it possible that when you choose to not use your insurance that you paid for, things got cheaper? And so let's try to understand something called a pharmacy benefit manager. A pharmacy benefit manager is a company that exists owned by insurance companies to negotiate rates on medicines. And the pharmacy benefit manager is working to then say, if you have Aetna or if you have Blue Cross, then this is what your medicine's going to cost. And it's going to cost that from this pharmacy. But then it's going to cost something entirely different from a different pharmacy. And then you want to look at your doctor and say, can you write something that I can afford? And we say the same thing every time. We have no idea what your insurance is going to pay or not pay. Yeah. And it does now, if you go to a mail order pharmacy, it'll cost one thing. If you go to your local, and this just really makes me frustrated, if you go to your locally owned independent pharmacy where there are people who have been taking care of people for generations, there's a human that says, don't take this medicine at the same time you take this medicine because that'll have a really bad outcome. Yes. You're not allowed to go to that person at all anymore because that's going to cost you so much more. Instead, your insurance company is going to tell you, oh, it'll cost you half the amount if you go to the mail order pharmacy, CVS Caremark, or some of these others. Well, and the mail order pharmacy has 0 humans.
Yes. Well, that's what I was going to say.
We could call that mail order pharmacy and we will be on hold. Our MAs have been on hold for 2 hours before trying to speak to one of these pharmacies.
Listen to that music. But that's one thing too, I think people don't understand. A pharmacist is part of your healthcare team.
Yes.
So you need a pharmacist that knows you. We want to locally, I tell them my insurance, we have Blue Cross Blue Shield. And we are supposed to use CVS, and I use Carmichael's, and I just pay more. Yeah. And the reason is because I walk in the door and they know me. Yes. They know my children. They know my husband. You know, they will come out and say, hey, and it was funny because my son's now 18. And so when he went to pick up a medicine, they were like, hey, do you need counseling on this? And he's like, no, I've got my mom. But you know what I'm saying? Like they at least asked him because he was like, Mom.
Know who your mom is?
Yes. And so anyways, it was just really nice to say, hey, he's an 18-year-old kid picking up a medication. Do you need some counseling on that? You're not going to get that on Express Scripts.
No, you're absolutely not. And with mail order pharmacies, there's so many errors that happen because they just keep mailing stuff out. Sometimes we've stopped that medicine, but you can't talk to them and tell them not to mail it out. Then someone who doesn't understand their medicines gets bottles, so they start taking bottles and they already have that bottle. So they're doubling up and it's a nightmare.
Yeah.
And it's always been a nightmare and they've always been impossible to work with. And every year, more and more patients are required to use them. And let's talk about required to use them. That is actually illegal in the state of Georgia. There is, and I've tried to make notes so that I will speak intelligently about something that makes no sense, but I'm trying. Georgia law in 2020 has the anti-steering law because pharmacies are steering people to insurance companies are steering people to have to use a certain pharmacy. And so they came up with a law to say, you can't do that. That's not fair market. That's not appropriate. And guess what? They're steering you to use the pharmacy that they own. Isn't that convenient?
One of the ways they're doing it is, we were talking about this, is that like you can get a 30-day at CVS, but if you do it, you can only get a 30-day versus a 90-day, and like compliance matters.
Yes.
So that's kind of one way that they may be steering you, is that you can use it locally, but it's only 30 days versus if you use their mail order, it's 90 days.
You can get a 90-day supply, and they'll make everybody local out of network.
Yeah.
And so legally, they let you use them, but they make you pay twice the amount. Yeah. And so our local pharmacies are really struggling
because the insurance companies are absolutely steering everyone away from them. And it's illegal. And yet the people with the power, the insurance companies with the power, are steering people because they define the cost. And when you define the cost, you define a lot of things. There's a couple of things as far as medicine costs that I want to point out. So it is ridiculous, and we all should be up in arms about the fact that you pay for insurance and your medicine costs more when you use your insurance. But in attempt to try to get you your medicine, I think a lot of people are familiar with GoodRx now. And then there's kind of a new approach to getting people their medicine that I think people are less familiar with, that I want to make sure people know about. And that's places like Cost Plus Drug Company. Cost Plus Drug Company is owned by Mark Cuban. Mark Cuban is the Shark Tank guy who I think still owns the Dallas Mavericks or is
something
that
with
a
basketball
team. I might have made that up. But anyway, Mark Cuban is a rich man, and he is doing good things in healthcare. And so he has Cost Plus Drugs. And the reason it's called this is because he puts the cost out there, and with the cost, then he adds 15%. If his cost goes down, your cost goes down. This is a mail order pharmacy out of Texas, and everything is absolutely transparent. And although we've made laws for transparency and pricing in healthcare, there is none.
Yeah.
Absolutely none. That nobody is following any of these regulations really. But Mark Cuban's actually has Cost Plus Drugs to say, this is the cost of making it, and we're going to charge you 15% more, period, the end. And so you can look on there and find cheaper drugs and send your prescriptions there. That's different than the way GoodRx works, where GoodRx is more of kind of a coupon model. And so GoodRx will negotiate with pharmacies to have a better cash price. And that's why when you look on, and GoodRx has also done a good job of making that cash price readily available on the internet. So you look up GoodRx, you put in your zip code, you see all the different pharmacies and what the cost will be. And the reason there's variation there is because GoodRx will negotiate a certain rebate or coupon with CVS, make it one cost. They might get a different negotiation with Walmart, and it's a different cost. But it is a good way to look. And again, both of these you're paying cash, even though you have insurance, you're paying cash for these drugs.
Yeah.
The other, pharmaceutical, we could do an entire episode on pharmaceutical companies and how they run up the cost of healthcare as well. But the Cost Plus Drugs is only for generics. They're not allowed to produce anything that's branded. And so if you're on generic medicines, that's a good place to look. But why is it that medicine costs so much, and why is it that medicine is so difficult to get a hold of? I don't know, but we've got to do better. We've got to do better.
All right, you ready for the second question?
I'm ready for the second question that I would probably...
Again, makes me laugh because how you wrote it. What is happening where insurance companies do whatever in the world they want and get away with it, which is so true.
Whatever in the world they want. Boy, we could go on. And this is what I was saying in social media. A lot of doctors are out there saying, you would not believe what I had to deal with today. And I will tell you, when I am sitting with patients now, I am saying at least once a day, because it organically comes up, our country is in a healthcare crisis. And that healthcare crisis is largely driven by our insurance companies and the fact that they have all the power. And the people who are the number one getting screwed the most are the patients. And the number two getting screwed right behind them are independent doctor-owned practices.
Like ours.
Yeah. Because we don't have the clout with the insurance companies, and the insurance companies are simply bullying people. And so let me look up online the story of Dr. Elizabeth Potter. Dr. Potter is a hero. I have followed her in Instagram, and I encourage everyone to follow her on Instagram, because the more power we give people like Dr. Potter, the better off we will all be. Dr. Potter's a plastic surgeon who primarily does reconstructive surgeries for breast cancer survivors. And she tells her story of the absolute ridiculousness that she has to deal with that is put toward her by insurance companies all the time in her post. So she posted, she was in the OR operating on a patient that she wanted to keep in the hospital that night. This is a cancer patient who she's doing a full reconstructive breast surgery on. This is a big surgery. Insurance company wants a prior authorization on the hospitalization. They don't want the patient to spend the night in the hospital, and they need it right now. She scrubs out, if I understand this story correctly, she scrubs out from operating on a patient to go get approval for that patient to spend the night in the hospital. That patient could have died while her surgeon was out of the room.
Yeah.
And that surgeon needed to be focused on one thing and one thing alone, that surgery. But no, she's focused on fighting with United Healthcare. So she blows United Healthcare up in a post afterwards, simply telling the account of events. She didn't call them names. She said, here's how my day went, and here's what happened while I was trying to take care of a patient today. Oh, United Healthcare got their biggest bullies out, and they started bullying her as much as they could. They took her surgery center that she owns out of their network, so that anyone that she was participating in care with in that moment might have been scheduled for the very next day would not be able to get a surgery from her in her own surgery center. And they got their legal team. Imagine United Healthcare's legal team versus some surgeon in Texas. And they started sending her all kinds of harassing and threatening to sue her or suing her. I don't know how deep it all got, but she just kept posting. And she was brave because the bullies were coming and they were coming strong, and she kept posting. And finally, some of our government leaders got a hold of it, and they made United Healthcare stop. And United Healthcare had to put her back in network and pull all of their bulldog lawyers off of her. And she just kept fighting, and she continues to keep fighting. And there are doctors all over the place who are constantly not able to focus on their patients, but instead being focused on these insurance companies. Mm-hmm. But the insurance companies are letting us know they are louder, they are more powerful. I get letters all the time from Blue Cross, from United, from pretty much any of the big guns. That say, oh, did you mean to bill this amount? Because that's a higher amount than your peers might have built. And I said, well, do you want my note?
I was about to say, read the note. That's what I always say.
And in our clinic, I've had to write Blue Cross a letter that said, in our clinic, we won't make you just have one problem. If you have multiple problems, we'll talk to you about multiple problems. We want to talk to you about what you need us for today. And so then when we bill to say, we talked about 6 things in this visit today, which is not unusual for me.
Ever.
Then they send back and say, well, we don't want to pay you to talk about 6 things. And so if you ever get annoyed at your doctor because your doctor says, I can't talk to you about 6 things today, it's because insurance isn't going to pay them. Yeah. If they spend extra time with you and then they don't have another appointment after that, if you have a half an hour visit instead of a 10-minute visit, insurance doesn't want to pay. They want to pay you for a 10-minute visit. Mm-hmm. And so all we can bill on is our time, and you can't afford it. Insurance has made it so difficult to do anything in care for patients. And then when you try to do anything, they bully you. Yeah. The Affordable Care Act tried to stop insurance companies from benefiting so much off of not caring for people. And so there's something called a medical loss ratio. And the Affordable Care Act made law that the insurance companies have to reinvest 80% if they're a smaller company, 85% if they're a larger company, of the money that they make into care for humans. So you can't just say, well, I'm going to charge you all this money, get rich, and then give you no care whatsoever and get more rich. And that's what was happening. This law comes about because we had to combat what was happening. But insurance companies have figured out a way around that. Surprise, surprise. So first of all, they make your premiums go crazy high. We as a small company will pay between $100,000 and $150,000 more to offer health insurance to our employees than we did last year. As a small company, and any small company owners or CFOs that are listening will know, we can't stay on this train. This is impossible. Small companies don't have the money to do this. Yeah. You don't have just $200,000 sitting around in your extra reserves as
just in case premiums go up.
Yeah, to help make sure that you care for your employees. Yeah. And so they've made the premiums go up. Well, if all they did was keep their 15% of more is more. Yeah. And so they just keep charging you more and more. There has to be a cap on what they can charge, but there's not. And then the other thing that they're doing with this medical loss ratio is they're paying themselves. So let's talk about the vertical integration.
Okay.
So what we have is, let's use the example of CVS Health. And CVS Health owns, and I have this listed out because it's too much to remember, Aetna Insurance. So CVS owns Aetna. CVS owns 239 Oak Street medical clinics across America. CVS owns the Minute Clinics that exist in CVS, and it owns Health Hub, which is not something I'm familiar with, but also exists in CVS clinics or CVS pharmacies as a clinic. Of course, CVS Pharmacy, CVS Caremark, which is a pharmacy benefit manager. So CVS, who owns Aetna, is deciding what your drugs cost. This doesn't seem like weird and monopoly or un-American in any way. So the people who decide what your drug cost are the same as the people who pay for the drug, or won't pay for the drug. And CVS owns a drug manufacturer called Cordavis. CVS probably owns some other things that I couldn't find online. But if I want to make sure that I meet my medical loss ratio and I have to reinvest 85% back into the care given, then let's own the doctors. And I'm going to guarantee you that what CVS pays their doctors is not the same as the contract that they pay us.
Yeah.
And so you can say, well, charge me 10 times as more, and I paid for the doctor's visits, but I actually paid myself for it. Yeah. So all they're doing is taking money out of the right pocket and putting it in the left pocket, and they still have all the money.
Yeah.
So they've completely sidestepped this medical loss ratio. And then what they're going to do is, if any of you could sit in when I fight with insurance companies over contracts, it would blow your mind. As a small clinic, I have zero voice. I can't get anyone at an insurance company to even answer calls. We take care of 200 people in a small county in Georgia every day. We see over 200 people a day.
I would say more
Nobody
than that.
cares,
Yeah.
because the hospital owns systems, and Oak Street clinics and CVS own systems. They take care of a lot more. So when I try to negotiate a contract, I will get paid a third for the same exact visit and better care than these other clinics will. So the idea here really is insurance owns everything, and they have all the power. And then my last prompted question.
Yes. Well, there's two. Where have all the independent physician groups gone? Which essentially you kind of answered in the last one. Like,
yeah,
they're
we
just
can't make it.
You can't. Yeah, you can't.
They won't give us the contracts. They won't pay us as much. And what used to be 1 to 2, so 50 years ago, a doctor could be supported by 1 to 2 staff members. And when you went into your doctor's office, you'd see the same 1 or 2 ladies. They'd take care of you. That was their whole staff. Now it is roughly 6 staff members because of fighting with prior authorizations, yes, fighting with denials, you name it. It's a mess. And so we need 6 staff members to fight with insurance companies. We need an entire billing team to fight with the fact that they won't pay us. So no one can afford that anymore.
Yeah.
So small practices like ours that are physician owned and led are very rare. Most practices, over 70% of practices, are owned by hospital groups, venture capitalist groups, insurance companies. And so it's hard to exist.
But we're fighting it.
And then our most important question that we want to answer today is,
what can we do?
What can we do? What can everybody who's listening, what can all of us do? And the one thing I really want to leave you with is, I'm not a big fan of most things that happen in politics. And I think that's probably true of just about everybody, because on one side or the other, you dislike something. But there's something going on that Republicans and Democrats are both fighting for. Senator Elizabeth Warren, who's a Democrat from Massachusetts, and Senator Josh Hawley, who's a Republican from Missouri, have a bipartisan bill that is called Break Up Big Medicine. And so I would like to ask each of you to stop what you're doing, to get online, if you Google contact my representative, it will take you straight to the page. You put your zip code in, and I want you to tell your representatives to vote for the Break Up Big Medicine Act, because we need legislature over this. It is too far gone for any of us to bring back on our own.
Yeah.
But if we have insurance, continue to make our healthcare decisions, it's going to get messier and messier. And then the other thing that you can do is know who owns your doctor's office. And if you have the opportunity, and I hope you do, to go to a physician-owned doctor's office, choose that one. We know how to take care of you.
Yeah.
Nothing in our practice happens without Amber and I touching it.
We laugh about that. Probably what is Jamie's title?
I don't even know. Our COO.
COO.
He used to run. I don't
even know Jamie's title. Jamie, I'm
health
sorry.
Systems. In nursing homes, and so he'll say, "Who's on this team and who's on this team to get?"
We
things
are
done?
the team,
and we're
Jamie.
like, "We're on all the teams. We're on all the teams." Because we touch everything, and if something's not going well, we change it immediate. We are a kayak. We can turn around very quickly. You cannot turn a Titanic of a hospital system around.
No.
And you can look into, this is not us saying that physician-owned practices do better. You can find a lot of articles, a lot of research, and a lot of evidence that support that patients get better care in physician-owned practices. So today was not a feel-good episode, but today was the real.
It was education.
And what our ask is let us practice medicine. Let us take care of people. Let people be able to access care and afford it. And let's all put this as a high priority to make the people who make the rules also make this a high priority.
We like to leave you on a good note. Today's Tell Me Something Good is put down your phone. This is a hard one to do because I like my phone. I like to be mindlessly scrolling at night, but it's not really beneficial. My son's actually on a mission trip to Costa Rica and they cannot have their phones the majority of the day. And he mentioned to me, Mom, I got ready so much faster. I'm like, I've been telling you this for 18 years. So take my advice, and like my son who took 18 years to do it, put your phone down. Thank you for joining us today. And until next time, take care of yourself.